Thank you for coming in today. Let's get started. Can you first tell me what areas of nursing you are most interested in and why?
Well, I've been a cardiac nurse for 14 years on a cardiac intermediate floor, so I would like to continue to pursue into cardiac care. I would like to move into critical cardiac care and see if I can advance my skills as a cardiac nurse.
Okay, so can you tell me a little bit about your clinical experiences and which rotations you enjoyed the most?
Well, during my clinical experience, during this program that I just currently went through was the emergency room was the most exciting for me. I felt like it put me the most outside my comfort zone. I was able to get several different skills in that I hadn't already had. In my current clinical experiences that I do every day as an LVN, I do care for patients with chest tubes and stable vents, post-cab patients, and so I have many experience in cardiac care. But in the emergency room, I was able to encounter different diagnoses that I normally would not see on our unit.
What was the biggest mistake you've ever made and how was the problem resolved?
Well, there was one time that a doctor wrote an order and the pharmacy transcribes that order onto our MAR. Well, pharmacy had transcribed it incorrectly, and the medication was given as a new order, and the med error was not caught until after the medication was given. So, of course, we had to notify the physician and inform the nursing supervisor. The patient, it didn't give any harm to the patients, but they did implement new procedures on checking the meds to the MAR as a second check to make sure the medication is correct.
So can you tell me a little bit about yourself and what your strengths and weaknesses are?
Well, as I mentioned, I've been a cardiac nurse for 14 years. I have highly enjoyed what I do. One of my strengths, I would have to say, is educating and keeping my patients informed. I have a motto I've always used is, if I know, you know. So I always inform my patients of their plan of care and what is going on and what they should expect throughout the day. One of my weaknesses would be delegation. I have a hard time delegating tasks that I need help with. I feel like it's tasks that I can do, so why can't I do them? But sometimes you just don't have enough time in the day to get everything done in nursing. I have learned in this RN program that that delegation is a huge part of nursing, and it is something that I need to work on so I don't get so stressed out when there's so many different tasks that need to be done all at one time.
Give me an example of a staff nurse who most impressed you and why.
I've come in contact with several different nurses throughout my career. But I guess there's one that actually I learned the most from, and it's kind of where I get my motto from. But she was very loving and caring, and to each and every one of her patients, she was able to establish a trusting relationship with the patients right away. As she would go into the room, she would explain every little detail that she would do, down to wiping with alcohol before she gave a shot. I took that with me, and I feel like it really does help with the patients and their anxiety and informing them of what they, if they know what's going on.
How would your most recent instructor or preceptor describe your performance in your clinical settings?
Well, during my evaluation, my preceptor informed me that she was very impressed with how prepared I was for each clinical rotation, and one thing she mentioned was she was impressed with how I always showed confidence in the skills that I was going to do. That seemed to help ease the patient's anxiety if you show confidence in your work.
Can you give me an example of your most challenging clinical assignment and what you learned from it?
I guess, let's see, in the last rotations that I went through, we had a group of patients. One of them had an amniotic drip, and we were down a nurse that day. So on top of the 4 patients we had, we were given a transfer that was coming from the medical floor. And they were also going to need to be started on an amniotic drip because they were in AFib RVR. The patient arrived from the medical floor and they had not been admitted for very long. So none of their home medications had been renewed or reviewed by the doctor. The cardiologist hadn't been notified. The amniotic drip order was given by the primary care doctor. And but after reviewing the home medications, the patient had several cardiac meds that they had not received in the past 12 to 18 hours. So that was the main reason they had gone into AFib RVR. So we notified the doctor and the cardiologist, and he informed us to give the meds and hold on the drip. But it was difficult because we already had a full load, and then we're getting a patient that seemed pretty critical, and it really, made it really stressful trying to figure out how we were going to manage everything.
What clinical skills do you feel you have gained from your past work experiences that would help you in this position?
Well, I feel being an intermediate cardiac nurse for the past 14 years, I have had experience in stable vents and chest tubes. So going into a critical care cardiac nursing position those things would help me out already having the experience as an intermediate cardiac nurse.
Tell me a little bit more about yourself and how others actually describe you.
Well, I find I'm fun, loving, energetic. I live life to the fullest. Most people tell me how I'm caring, and I always think of other people before I think of myself. I go out of my way to help people out, and if I have $1 and it's my last one, I usually, will give it to you if you need it more than I do.
What are your future career plans, and where do you see yourself in 2 to 5 years?
Well, I hope to further my education and finish my bachelor's degree in nursing in the next few years. I've always wanted to go into management, higher up management, but in the next 3 to 5 years, I'm hoping I could possibly move into a charge nurse role or assistant nurse manager role, and continue my career in that direction.
We currently do not have any openings at the present time in the area in which you have indicated you have the most interest in. Would you be willing to accept a position in another area? And if so, which area would interest you the most?
I've never really thought about anything other than cardiac, but I guess if I had to choose something other than cardiac, I would think the emergency room would be something I really would be interested in. I enjoyed it back in my rotations during LVN school. I enjoyed it during my rotations in RN school, and I really think it would push me into a different direction, but it would definitely be something I would be interested in.
Tell me about a time in your clinical experience that you have had to establish priority. Can you
I guess priority we use every day. But in the last clinical rotation, we had a patient come through. We were getting a new patient from the cath lab, and they showed up and to drop the patient off. And I was in the middle of giving some hydralazine IV to a patient that had a blood pressure of 189 over 105. So I had to inform that nurse to if she could hold off and wait with the patient until I was able to get this blood pressure under control. By that time, my charge nurse actually went in and accepted the patient, but I had to take care of the blood pressure before I accepted the new patient.
Give me an example of when you went out of your way to assist a family or a patient, even though you really didn't have the time.
Well, I always try to help my patients out in any way I can. But I guess there was one incident when I was super busy, and the family member, was very concerned about the discharge of the patient and where she would go because she was not as steady and she couldn't go back to the assisted living. So I took it upon myself to give them more education and information about different things that they could use, such as hospice or home health or even skilled nursing facilities. The patient was an elderly lady and was newly diagnosed with congestive heart failure. She did not want to have any interventions done, and her ejection fraction was very low. So giving them that hospice information and educating them on that hospice really did help out the family in what she could do for the patient for discharge.